In 2005, Hu Haitao took his son, Hu Bing, to a local clinic in East China's Shandong province. There, the 4.5-month-old baby received a vaccination to prevent polio. But 14 days later, the infant showed signs of a serious reaction.
My baby experienced diarrhea and respiratory failure. He was critically ill and had to stay in the ICU.
The child slipped into a brief coma and also experienced heart failure after being taken to the hospital. He recovered after 3 days of treatment, although his left leg has since become paralyzed. The hospital said he was suffering from polio, but did not give a more specific explanation.
They told me it was a viral infection, but they didn't tell me which virus it was.
Ma Yongmin said her 6-year-old daughter Zhang Liang also had a bad reaction to a vaccination. Ma believes that the varicella vaccination that her daughter received in December 2012 caused her to become bedridden.
On the morning of December the 25th, my daughter felt pain in her back and was reluctant to go to school. At first, we thought she just didn't want to go to school, but she kept complaining, so her father took her to the hospital.
The doctor asked me if she had received any vaccination. I told him yes, she had a varicella vaccination. The doctor told me that the vaccine can possibly lead to illness, but we didn't think it would become so bad.
Zhang Liang then lost feeling in her body below the waist. Her father took her to a major hospital in Shandong's capital of Jinan, where she was diagnosed with myelitis.
She suffers from incontinence and her legs cannot feel any pain or temperature changes. From a medical perspective, she is paralyzed from the waist down.
Zhang used to love dancing and singing, but now she can only stay in bed and watch cartoons. Although she has been receiving therapy for her condition, she is not expected to walk again.
The recovery is not going well. There is little hope for her to completely recover.
Vaccination is the administration of antigenic material to stimulate an individual's immune system to develop an adaptive immunity to a pathogen. Although vaccinations are safe for the vast majority of the population, people with impaired immune systems may suffer from complications.
If a person's immune system doesn't work properly, it is unable to stimulate antibodies. Therefore, rather than being destroyed in the body, the pathogens attack the nervous system and actually cause the disease that they're supposed to prevent.
According to Wang, there can be several different reactions to vaccinations. Some may experience sudden edema or epilepsy and can be cured after receiving timely treatment. Others, however, may experience irreversible damage to their bodies, an effect referred to as vaccine sequela. Zhang's father had never heard of vaccine sequela until his daughter became ill.
I had never considered such terrible consequences. The doctor only told me how good the vaccine would be, but never said anything about possible side effects.
Wang Yu said vaccine sequela can theoretically be prevented through preliminary testing. However, these tests cannot be put into actual practice.
Impaired immunity cannot be detected using current technology. We can only judge a patient's condition by their medical history.
According to the Chinese Center for Disease Control and Prevention, about 500 million vaccinations were given in the country last year. Adverse reactions occur roughly once for every 1 million vaccinations, which means about 500 people suffered from such reactions last year. It may take days to several months for a patient to develop symptoms, which can make it even more difficult to identify an adverse reaction. Hu Haitao, for instance, discovered his son's illness by accident after discussing his child's condition with another parent whose child was showing similar symptoms. After conducting more research, Hu decided to have his child tested to see if his illness was truly caused by the vaccination. He had to wait 14 months to discover that his child had indeed been sickened by the vaccine. Hu then decided to file a claim for compensation.
I have very mixed feelings. On one hand, I was happy to get the test results. On the other hand, they mean that my son will be permanently disabled.
Zhang Gongxian is still working to find out whether his daughter's condition was caused by the vaccination she received. He has already spent more than 100,000 yuan, or $16,338 on medical treatment for his daughter. But debt is not the family's biggest concern.
Compared to the debt, we are more worried about our child's future. What can she do if a condition doesn't improve?
Seeing doctors and receiving multiple treatments are now a regular part of the Zhang family's life.
We wake up early in the morning to do some physical therapy. After she takes her medication, we go to the clinic for acupuncture therapy, which usually takes 3 hours. Then we go back home to have lunch and start physical therapy again.
There are many families just like the Hu and Zhang families who are going through similar ordeals. Parents are seeking both help and compensation from the government, particularly those whose children are still in the early stages of their illnesses.
I think there should be a system created as soon as possible to help us. For instance, if they took just 1 cent from each vaccine, it would amount to a lot of money. That money could be used to help children and families like ours. It would help a lot. Our child has already passed the optimal treatment time.
11 types of free vaccines are currently offered to children born in China. A greater number of vaccines can increase the risk of complications. Wang Yu said multifunction vaccines are being used in developed countries, helping to lower the risks posed by multiple vaccinations. The use of old and outdated methods to produce some vaccines in China is also a problem.
The fundamental element is the quality of the vaccine. Our methods of producing vaccines used to be very simple, but now it's much better. The process is much more careful and detailed. However, we are still using old methods to produce some vaccines.
Based on local annual incomes, the Chinese government gives compensation ranging from 100,000 to 300,000 yuan for patients with vaccine sequelae. However, many families have found that the compensation is far from enough. Hu Haitao said his family has spent more than 200,000 yuan to treat their son so far. He isn't sure how much they will have to spend in the future.
My son will undergo his second operation soon. The doctor told us he is expected to require 15 operations from now until he turns 40. We can't imagine how much money we will need.